Okay, so I welcome you to the third session of the head injury. So in this session we will discuss about the NICE guidelines for CT brain in head injury. But before that, I will like to revise once again the points we discussed in our last session about the skull base fractures. There I mentioned that the entire skull base fracture has recognized yellow sign, right, and middle canal fossa petal fracture as battle sign, hearing loss of balance, all right, and paradoxical rhinorrhea, right, and posterior skull fossa fracture as your visual disturbance, cervical spine injury, Barnett syndrome, right, Barnett syndrome, sixth nerve injury, right. So this is your entire skull base fracture, middle and posterior fossa fracture, right. So this was our last session, right. So from here on we will discuss about NICE guidelines for NCCT head in case of head injury, right. So NICE guidelines, NICE is National Institute for Health and Care Excellence, right. So they have, so today's topic is NICE guidelines. So this is a very lengthy table, so I will make it short for you, which is important for your exam point of view. I will mention that points only, and so I will request you to keep your attention, right. So the topic is, one second guys, NICE guidelines, right. So first thing is that cervical spine injury, you should suspect cervical spine injury in any patient of head injury. This is your first point. In any case of head injury, cervical spine injury should be suspected. Until unless you rule out cervical spine injury, you should always suspect it, that there may be cervical spine injury in almost all patients of head injury till you rule out. Then there is GCS monitoring. So while we were in the emergency department, we always used to see that our resident doctors used to say that monitor the patient half hourly, 1 hourly, 2 hourly. So there was an importance of it, right. So this is this I will mention here in our GCS monitoring. So here what they have said, that in case of first 2 hours you have to monitor GCS every half an hour. In first 2 hours of head injury, every half an hour GCS monitoring is required in first 2 hours. Then in next 4 hours, every hourly monitoring, and in next 6 hours or after 6 hours, every 2 hourly monitoring of GCS is required. This is their guidelines, right. Now we are coming to the main important point, that one second, what is the indication to involve a neurosurgeon? Indication to involve a neurosurgeon. First point is, when GCS is less than equals to 8, we should involve a neurosurgeon. Second point is unexplained contusion. Unexplained contusion more than 4 hours, right. And third point is when GCS falls after admission. These are the 3 points which you should remember, that these are the indications for involving or calling a neurosurgeon when GCS less than equals to 8, unexplained contusion more than 4 hours, and GCS falls after admission. Apart from this, there are other points mentioned, that if there is loss of consciousness, if there is ENT bleeding from your nose, and if there is more than 2 episode vomiting, right, if there are seizures, if there is focal neurological deficit or FND, if there is cranial fossa fracture, if there is penetrating CNS injury. Right now is your what I will be telling is your NICE guidelines for NCCT head. It's when you should go for NCCT head. Very important point. First of all, everything that is mentioned from point 4 onwards, these are indications for NCCT head. Plus there are few other factors like when GCS is less than 13 at any point, GCS less than 13, you should go for NCCT head, or GCS more than 15 at 2 hours. Every point is important, right? And age more than 65 years, also more than 2 episodes of vomiting that I mentioned previously, right? Coagulopathy, dangerous mechanism of injury, right? And 6 point, retrograde amnesia more than 30 minutes. That is, the patient forgets everything, right? So in these situations you have to go for NCCT, right? And also there was a question, right, when is NCCT the investigation of choice? So in these 3 conditions, NCCT is the investigation of choice, right? Head injury, salivary gland stones and renal stones. Here NCCT is the investigation of choice, right? So we'll try to revise the points before we wrap up the session. So this is your NICE guidelines, right? So I will try to discuss it from the first point itself, that in every case of head injury you should suspect cervical spine injury. This was the first point, right? Second point is you should perform GCS monitoring. So in first 2 hours it should be every half an hour monitoring, for next 4 hours every hour, and next 6 hours every 2 hours. Where you should include a neurosurgeon when the GCS is less than or equals to 8, unexplained contusion more than 4 hours, or GCS falls after admission. And also in conditions where there is loss of consciousness, there is ENT bleed, seizures, cranial fossa fracture, penetrating CNS injury, more than 2 episodes of vomiting, and focal neurological deficit. Also, I would like to mention that all these points from the fourth point onward are also the indications of NCCT head, plus few other conditions like where GCS less than 13 at any point, or GCS more than 15 at 2 hours, age more than 65 years, coagulopathy, dangerous mechanism of injury, retrograde amnesia more than 30 minutes, right? These all are indications of NCCT head. And in all conditions, NCCT is the investigation of choice in case of head injury, salivary gland stones and renal stones. This has been asked and very important. This is about the NCCT guidelines, and next we will see we will talk about the brain injury, right? SAH, SDH, EDH all will be discussed, right, in our next sessions. Thank you.